Hello, my friend. Let me ask you something. Have you ever woken up in the morning and noticed your face looked a little puffy or your feet felt swollen and you just thought, maybe I slept too much last night? Or maybe you've been urinating less often and the color's darker than usual, sometimes even a little foamy, but you brushed it off thinking it wasn't a big deal. Have you felt an itch that just won't go away? Leg cramps in the middle of the night? Or maybe you've noticed that you're short of breath, your heart racing, even after just a few steps. These might seem like random, unrelated things, but they could all be soft whispers from one place in your body that's often overlooked, your kidneys. According to the CDC, over 37 million Americans are living with chronic kidney disease. And here's the part that worries me. Almost 90% of them don't even know they have it. Why? Because the kidneys are silent workers. By the time symptoms become obvious, it's often already advanced. That's especially concerning if you're over 60, because as we age, kidney function naturally begins to decline, and most of us don't give it the attention it truly deserves. In today's video, I want to gently walk you through 6 early warning signs that are often ignored. These signs may seem small at first, but they can help you catch kidney problems early, before they turn into something more serious. I'll share real-life examples, simple explanations backed by science, and easy tips you can start using right at home. If any of these signs sound familiar to you, please don't hesitate to share in the comments. You're not alone, and your story might help someone else recognize their own. And if you find this video helpful, I'd be grateful if you click subscribe. That way we can keep meeting here each week and continue these calm, thoughtful conversations about health and aging with grace. All right then, shall we get started? Swelling in the face, legs, or body, especially in the morning. Now let me ask you something. Have you ever woken up, looked in the mirror, and noticed your face looked a little puffy or your eyes felt heavy like you'd cried the night before? Maybe your shoes, the ones you wear every day, suddenly feel tight. Some folks joke must have slept really well. My face is swollen from too much rest. But my friend, this isn't something to laugh off, because swelling in your face, legs, or even your whole body, especially in the morning, could be your kidneys trying to get your attention. It's not unusual for older adults to wake up with mild puffiness, and yes, sometimes it's due to salty foods, poor sleep, or sleeping in an odd position. But if this happens day after day, it's time to pay closer attention. You see, morning swelling is often one of the first signs that your kidneys aren't filtering salt and water like they used to. When kidney function starts to decline, fluid builds up in soft tissues, especially in the face around the eyes, hands, and feet. And in the morning, after lying down all night, that fluid tends to settle in the upper part of the body. After age 60, kidney function naturally begins to decline, and many older adults also live with chronic conditions, like high blood pressure or diabetes, that quietly damage the kidneys over time. Here's what makes it dangerous. Mild swelling doesn't hurt. It doesn't feel alarming. So many people ignore it. Older adults often live with small discomforts and delay getting checked. By the time it's diagnosed, kidney disease may already be at stage 3 or 4, when the kidneys have lost 60–70% of their function. Let me share a story. Mr. James, 72, from Texas, woke up most mornings with slightly puffy eyes and swollen feet. He figured it was just age, or maybe not moving around enough. His granddaughter, a nurse, gently urged him to get checked, but he'd smile and say, "I feel fine. It's just a little swelling." A year later, he began feeling more tired. His blood pressure climbed. He lost his appetite. When he finally saw a doctor, he was diagnosed with stage 4 chronic kidney disease. He needed special care, ongoing monitoring, and he sighed and said, "If only I'd listened to that girl sooner." According to the CDC, over 1 in 7 American adults, that's around 37 million people, are living with chronic kidney disease, and nearly 90% of them don't even know it because the early signs are so easy to miss. A 2021 study in clinical nephrology found that facial and leg swelling are common early symptoms of kidney disease in adults over 60, but they're often overlooked or misdiagnosed. So if you've noticed any of the following again and again, puffy eyes or face in the morning, mild swelling in the feet or ankles, that heavy leg feeling, less frequent urination or urine that's dark or foamy, please get your kidneys checked. All it takes is a simple blood test to measure your GFR and creatinine, and a urine test to check for protein. That's enough to catch kidney issues early. And here's the good news: if caught early, kidney damage can be slowed, even prevented. Here are 3 simple things you can do at home. Reduce salt in your meals, read food labels, and cut back on packaged foods. Drink water properly, around 1.5 to 2 liters a day, unless your doctor says otherwise. Walk gently for 20-30 minutes daily. It helps circulation and supports kidney function. Your kidneys are quiet workers. They don't complain. They just keep going, day and night. But if we learn to listen to our body, even to small things like puffy eyes or swollen feet, we might catch trouble early and stay one step ahead of disease. 2. Changes in urine. A small sign that speaks volumes. Today, I want to ask you something that might seem small. When you got up this morning, did you happen to notice what your urine looked like? Some folks might chuckle and say, "Doc, I haven't even had my coffee yet. How am I supposed to remember that?" But here's the thing. Urine is like a quiet mirror. It reflects what's going on inside your kidneys, long before you feel anything else. And sometimes, just a small change, like foamy urine, or a darker color, or peeing less often, might be your body's early way of waving a red flag. Normally, our kidneys are busy all day and night, filtering blood and removing waste through urine. But when kidney function begins to decline, urine often changes in volume, in color, and in texture. You might notice urinating less than usual even when drinking enough water, frequent urination, especially during the night, going several hours without urinating at all, urine that looks dark like tea, foamy, or even tinged with blood. These are early signs of more serious conditions, like glomerulonephritis, nephrotic syndrome, or even acute kidney failure. And after 60, our kidneys naturally begin to age. The tiny blood vessels inside them become more fragile, especially if we live with high blood pressure diabetes or have taken certain medications long term. The problem is, changes in urine often come quietly. No pain, no discomfort, easy to ignore. Many people don't notice until the condition has already progressed. And by that time, treatment becomes more difficult, more expensive, and it can deeply affect your quality of life. Let me share a story. Mrs. Helen, 70 years old from Arizona. She noticed a few months ago that her urine was foamier than usual. She was also urinating less. She figured, maybe it was the heat, maybe she wasn't drinking enough. But then she started feeling puffy around the eyes, and her legs felt more tired. She finally went in for a checkup. The diagnosis: nephrotic syndrome, and early-stage kidney disease. She told me, if only I had paid attention sooner, things might have been different. According to the National Kidney Foundation, persistent foamy urine may mean protein is leaking through your kidneys, a sign that your kidney filters are damaged. Urinating very little, or not at all, can be a sign of acute kidney failure. This requires immediate medical care. And a 2020 study in the American Journal of Kidney Diseases found over 70% of older adults who showed changes in urine had already had silent kidney damage for at least 3 months. So if you notice any of these signs for more than 2 days, urinating less with dark-colored urine, foamy urine, or urine that appears reddish, urinating too often, especially during the night, please don't wait. See your doctor and ask for a urine test to check for protein, blood, or infection, a blood test to measure creatinine and GFR, to assess kidney function. These are simple tests, low cost, and painless. And the good news is, you can catch kidney disease early and manage it if you pay attention at the right time. Here are 3 habits that can help check your urine every day. Just a quick glance is enough. Drink around 1.5 liters of water daily unless your doctor says otherwise. Cut back on salty and processed foods. They strain the kidneys over time. Please don't wait until your kidneys start shouting. Sometimes, just noticing the little things, like the color of your urine, can help you stay ahead of something much bigger and protect your long-term health. 3. Persistent, dry, and itchy skin, a signal from within. If you've been struggling with an itch that just won't go away, and you're not sure why, then this message might be just for you. Many people think itching is caused by allergies, or just dry skin from aging, or a change in the weather. And yes, sometimes that's all it is. But when the itching becomes constant, when it spreads across your whole body, and especially if it gets worse at night, it may be coming from a place you'd never expect, your kidneys. You see, healthy kidneys remove waste like urea and phosphorus from your bloodstream through your urine. But when kidney function starts to weaken, those waste products build up in the blood, and they start traveling through your body, irritating the skin from the inside out. What happens then? Dry, cracked skin, a deep, spreading itch, often on the back, arms, legs, or even the face, no obvious rash like you'd see with an allergy, and creams and lotions don't seem to help. Itching caused by kidney problems feels very different from everyday itchiness or allergic reactions. Because it doesn't start on the surface, it starts in the blood. After 60, kidney filtration naturally slows down. That's a normal part of aging. But if you also have high blood pressure, diabetes, or have been on long-term medications, your kidneys may be under more strain than you realize. And here's the tricky part. Older adults often mistake this kind of itch for dry skin and don't think to check their kidney function. That's when we miss the best window for early treatment. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NNIDK, more than 40% of people with chronic kidney disease experience full-body itching, also known as uremic pruritus. And this kind of itch doesn't respond to antihistamines because it doesn't come from the skin, it comes from the blood. A 2021 study in the Journal of Nephrology found nearly 30% of early-stage kidney patients reported long-term skin itching before any other symptoms appeared. So please, pay attention if you experience persistent itchiness lasting more than 2 weeks, no visible rash or clear cause, no relief from allergy medications, other symptoms like swelling, fatigue, or reduced urination. The good news is, if caught early, we can slow the progression of kidney disease and ease the itching. Here are 3 simple things that help: drink enough water, about 6 to 8 glasses a day, unless your doctor says otherwise. Reduce phosphorus in your diet. Cut back on organ meats, cheese, and sodas. Moisturize daily, bathe in warm, not hot water, and wear breathable cotton clothing. Itching may seem like a small thing, but when it lingers, when it spreads, when it has no clear reason, it might be your kidneys trying to speak up in the only way they can. Don't ignore the message. Don't let a small symptom become a big problem. 4. Dull pain in the lower back. On or both sides, many older adults often say, "My lower back always feels sore and stiff," and most of the time we think it's just the spine, old muscles, or simply aging. But did you know a dull ache in your lower back, on one side or both, could be your kidneys quietly asking for help? And if we ignore that signal, it could lead to infection, blockage in the urinary tract, or even permanent kidney damage. Your kidneys sit on both sides of your spine, just above the waistline. When they're damaged, they rarely cause sharp pain, but they can create a dull, steady ache in your lower back or along your side. Sometimes the discomfort spreads to the lower abdomen or even down into the groin. You might feel a heavy aching sensation or a stabbing pain that comes and goes, especially when you shift positions or urinate. These could be signs of serious conditions like kidney stones, kidney infection, pyelonephritis, hydronephrosis, when the kidney swells due to blocked urine flow. Older adults are more at risk for these issues, especially if you have diabetes, high blood pressure, low water intake, long-term use of pain relievers or diuretics. Here's the hard part. Kidney pain is often less intense than muscle pain or sciatica, so it's easy to miss, easy to shrug off, until one day you feel something more serious. A fever, painful urination, blood in your urine. Let me tell you a story. Mr. Richard, age 73, from Pennsylvania. He had a dull ache in his right lower back for weeks. He thought maybe he had strained something. He rubbed some ointment on it, took a few pain pills, felt a bit better. Then the pain came back. Worse, it started to move into his groin. He had trouble urinating and a low-grade fever. When he finally went to the doctor, they found a kidney stone blocking his ureter. His kidney had started to swell. The inner chamber, the renal pelvis, was inflamed. The doctor said you came just in time, a few more weeks, and the damage might have been permanent. According to Harvard Health Publishing, lower back pain, paired with unusual urination symptoms, is a classic sign of kidney or urinary tract problems. And a 2020 study in American Family Physician revealed nearly 30% of older adults with kidney stones didn't know they had them because the pain wasn't sharp. Kidney infections left untreated can lead to acute kidney failure or even sepsis. So please be cautious if you have a dull ache in the lower back, one or both sides, for several days. Pain that radiates down to the belly or groin. Any of the following: burning urine, cloudy urine, reduced urination, or low fever. What can you do? Get an abdominal ultrasound to check for stones or swelling urine test, to detect infection or blood test, to assess kidney function. The earlier these problems are found, the better the outcome, and the lower the risk of complications. And at home, you can help your kidneys with these simple habits. Drink enough water. Unless you've been advised otherwise, don't hold in your urine. Go when your body tells you. Stay lightly active. Walking and gentle hip stretches can reduce pressure around the kidneys. Back pain isn't always about joints or muscles. If it's dull, persistent, and moves toward your lower belly or groin, please consider your kidneys. They may be sending you a quiet warning, and listening early might just save them. 5. Nighttime muscle cramps, a quiet cry for help from your kidneys. Have you ever been sleeping peacefully? When a sudden sharp cramp wakes you from your rest, your calf tightens, the pain shoots through your leg, and no matter what you do, you just can't stretch it out. Most people think maybe my feet got cold, or I haven't been moving enough lately. But here's what many don't realize. If those nighttime cramps keep coming back, especially in older adults, they might be a sign of electrolyte imbalance caused by declining kidney function. You see, when kidneys are healthy, they help regulate key electrolytes, like calcium, potassium, and sodium, all of which are vital for muscle control. But when kidney function begins to decline, that balance gets disrupted. Potassium may get too high or too low. Calcium becomes unstable. Sodium is either retained or lost in excess. The result: muscles become overly sensitive, cramps and spasms, especially at night when the body is at rest. In older adults, the kidneys naturally start to slow down due to aging. On top of that, many are taking medications for blood pressure or diabetes, like diuretics or other long-term prescriptions, which can further disturb electrolyte levels. The problem is, muscle cramps are often seen as normal. No big deal, just part of getting older. But rarely do we connect them to possible kidney dysfunction. That's why so many people miss this early warning until more serious symptoms appear, like swelling, low urine output, fatigue, or even irregular heartbeat. Let me share a story. Mrs. Linda, age 71. She used to wake up every night with painful leg cramps, so strong they would sit her straight up in bed. She thought it was the cold, or maybe she hadn't walked enough that day. But after a few weeks, she began to feel tired. She noticed some swelling in her feet. Breathing felt just a bit harder. She finally went to her doctor. They found her potassium levels were out of balance due to early-stage kidney decline. Her doctor told her, "If we hadn't caught this now, your heart could have been at risk." Thanks to timely care, she adjusted her diet, took medication, and the cramps disappeared. According to the National Kidney Foundation, electrolyte imbalance is one of the most common complications in chronic kidney disease, affecting over 50% of patients in stages 2 or 3. And a 2021 study in the Journal of Renal Nutrition reported nighttime cramps affect nearly 40% of older adults with a GFR below 60 millurn. It's one of the most overlooked symptoms, but often one of the first signs of serious imbalance. Please get checked if you experience nighttime cramps 2 or more times per week, muscle twitches, weakness, or unusual fatigue, accompanied by low urine output, swelling, or fast heartbeat. Ask your doctor for a blood test to check potassium, calcium, and sodium, a kidney function test, GFR, creatinine bun, an EKG if you have signs of heart rhythm changes. And here's what you can do at home. Drink water steadily throughout the day, not all at once before bed. Eat a balanced diet, reduce salt, and avoid too much potassium or sodium. Stretch before bed. Light ankle rolls or gentle leg lifts can relax the muscles. Don't let cramps interrupt your sleep every night. They might be more than just sore muscles. They could be your kidneys trying to whisper for help. Listen to those small signals, because early action is the key to long-term health and peace of mind. 6. Shallow breathing, fast heart rate, and palpitations. When the kidneys speak through the heart. Have you been feeling out of breath lately, even after just a short walk? Or maybe your heart feels like it's racing, thumping in your chest, even while you're sitting still. If your answer is yes, please don't brush it off. This may not just be your heart talking. It could be your kidneys sending a quiet warning. Shortness of breath, rapid heartbeat, that pounding, anxious feeling in your chest. They aren't always caused by anxiety or high blood pressure. Sometimes they're signs of serious imbalances caused by weakened kidneys. 3 problems in particular: metabolic acidosis, when the kidneys can't remove excess acid from the blood, anemia, because the kidneys stop making enough red blood cell hormones, high potassium levels, which disturb the heart's rhythm and electrical signals. These conditions directly affect your heart and lungs, leading to shallow or labored breathing, irregular heartbeat, that fluttering drum in your chest, and in severe cases, even cardiac arrest. Older adults face even higher risk because kidneys naturally slow down with age, because many live with diabetes, high blood pressure, or heart failure, and because diet and long-term medications can disrupt electrolytes. But here's the challenge. These symptoms, shortness of breath, racing heart, are often mistaken for just getting old, so people ignore them until something more serious happens. Let me tell you about Mr. Thomas, 74, from Oregon. Lately, he'd been feeling winded. Even walking a few steps around the house, his heart felt like it was pounding, like a drum in his chest. He figured maybe he was just out of shape. But then one day he felt lightheaded, lost his balance in the bathroom, and his family rushed him to the hospital. The diagnosis: severe hyperkalemia, high potassium, and anemia caused by stage 3 kidney disease. The doctor told him, if you'd waited just a few more days, your heart might have stopped. Thankfully, they caught it in time. He adjusted his diet, started treatment, and now his heart is stable and being monitored closely. According to the National Kidney Foundation, nearly 70% of people with chronic kidney disease struggle with anemia or mild to moderate acidosis, and high potassium is a life-threatening complication that can cause dangerous heart rhythm changes if not treated quickly. A study in the American Journal of Kidney Diseases reported 1 in 4 ER visits in kidney patients was due to high potassium levels, and most didn't even realize something was wrong. So please don't ignore these signs. Shortness of breath, even with light activity, fast or irregular heartbeat while resting, feeling faint, dizzy, or completely drained. If you experience these symptoms, ask your doctor for blood tests to check potassium, creatinine, GFR, and BUN, anemia screening, EKG or heart monitoring if you have palpitations or irregular rhythm. And at home, here are some helpful steps. Drink the right amount of water based on your doctor's guidance. Limit foods high in potassium, like bananas and potatoes. If your kidneys are weak, pay attention to your breath and heartbeat every day, especially after physical activity or during moments of fatigue. Shallow breathing and a racing heart aren't always harmless. They could be your kidneys, a quiet organ with a powerful message. Listen to your body. Check early. Take care of both your heart and your kidneys before they need urgent help. If anything in today's video felt familiar, if you've experienced one of these symptoms, please share your story in the comments below. I read every message, and I respond with the care and experience of someone who's been through this journey too. If this video helped you in any way, feel free to click subscribe so these quiet conversations can reach more people who need them. And if you have questions, concerns, or just something on your heart to share, leave it below. You're not alone. We're here to listen and to walk this path together. Thank you for staying with me till the end. I wish you peace and steady, lasting health, always.